The Ministry of Health spent over 30 billion shillings to procure 143 intensive care unit beds at the onset of the COVID-19 pandemic last year. Some of these have been installed in the regional referral hospitals, as others await ironing out of some issues, including provision of space.
We have a program of procuring about more 54 ICU beds. Out of the 54, 20 are going to Mulago and dedicated for ICU management. 34 will again be distributed to the regional referral hospitals. Our target is to ensure that every regional referral hospital has 10 dedicated ICU beds for COVID management.
Today, the Commissioner for Health Infrastructure at the Ministry of Health, Gov't, said the pricing of equipment has been affected by the current global demand.
Initially, it was about 180 million. That is, you're talking of ICU bed, patient monitor, ventilator. There's normally one X-ray for every 10 beds. You have the CT scan, not CT scan, ultrasound, and then very many other auxiliary equipment. The one we procured last year, the average was 210 million shillings, complete with the other 32 auxiliary equipment I'm talking about.
Otim says they are now moving towards local production of the same beds due to the sharp rise in demand.
We are embarking on the design to make our ICU beds locally in this country. Yeah, like I said earlier, these are the maternity beds, the delivery beds, and so on. They are simpler than the ICU beds, but we want to move progressively. We have identified 2 companies. You can see what they are making for us.
As of today, there are about 200 intensive care unit beds countrywide, but more than half of them are concentrated in the central region. Walter Mwesije, NTV.